Welcome to Calm Mind and Healthy Body, our channel. Low blood pressure, also known as hypotension, is a condition where the force of blood against the walls of the arteries is lower than usual. While high blood pressure is a well-known health concern, low blood pressure can also have significant implications for one's well-being. This video will explore the causes, symptoms, and treatment options for low blood pressure, shedding light on this often overlooked aspect of cardiovascular health. Understanding the significance of low blood pressure is crucial for maintaining overall health. While some individuals naturally have lower blood pressure levels without experiencing any adverse effects, persistent low blood pressure can lead to daily symptoms. By delving into the causes and symptoms of hypotension, viewers can better understand their health and take proactive steps to address any potential concerns. It is essential to recognize the importance of being informed about low blood pressure, as it can affect various aspects of one's well-being. Symptoms such as dizziness, lightheadedness, fatigue, and fainting spells can significantly impact an individual's quality of life and daily activities. By being aware of these signs, individuals can seek appropriate medical attention and management strategies to alleviate discomfort and prevent complications. Moreover, understanding the treatment options available for low blood pressure empowers individuals to take control of their health. Lifestyle modifications, dietary changes, and medical interventions can all play a role in managing hypotension effectively. By exploring these treatment avenues, viewers can make informed decisions about their health and well-being, ensuring they receive the necessary support to maintain optimal blood pressure levels. Low blood pressure is a significant aspect of cardiovascular health that deserves attention and understanding. Viewers can proactively manage their health and well-being by learning about the causes, symptoms, and treatment options for hypotension, leading to a healthier and more fulfilling life. Stay tuned as we delve deeper into low blood pressure and its impact on overall health. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. Low blood pressure can result from various factors, from underlying health conditions to lifestyle choices. Understanding the diverse causes of hypotension is essential for identifying potential triggers and addressing them effectively. In this section, we will explore the common factors that can lead to low blood pressure in individuals, shedding light on the multifaceted nature of this condition. Dehydration is a prevalent cause of low blood pressure, as inadequate fluid intake can reduce blood volume and lead to a drop in blood pressure levels. Additionally, heart problems such as heart valve disorders, heart failure, or a heart attack can impair the heart's ability to pump blood effectively, resulting in low blood pressure. Endocrine issues, such as thyroid disorders or adrenal insufficiency, can also contribute to hypotension by disrupting hormonal balance and affecting blood pressure regulation. Medications play a significant role in influencing blood pressure levels, with certain drugs like diuretics, beta blockers, and antidepressants known to lower blood pressure as a side effect. Nutritional deficiencies, particularly in essential nutrients like vitamin B12 and folate, can impact blood pressure regulation and contribute to hypotension. Furthermore, neurological conditions such as Parkinson's disease or autonomic nervous system disorders can disrupt the body's ability to maintain stable blood pressure levels. Lifestyle factors can also influence blood pressure, with habits such as excessive alcohol consumption, prolonged bed rest, or standing up too quickly leading to temporary drops in blood pressure. Engaging in regular physical activity, maintaining a balanced diet, and staying hydrated are essential for supporting healthy blood pressure levels and overall cardiovascular health. By recognizing the various causes of low blood pressure, individuals can take proactive steps to address underlying issues and manage their condition effectively. Stay tuned as we delve deeper into the symptoms and treatment options for hypotension, providing valuable insights for maintaining optimal blood pressure levels and overall well-being. Hypotension, or low blood pressure, refers to a condition where the force of blood against the walls of the arteries is lower than usual. To avoid confusion, it is essential to differentiate between hypotension and hypertension, which is high blood pressure. While hypertension is a well-known risk factor for cardiovascular diseases, hypotension can also have significant implications for overall health and well-being. Chronic low blood pressure can pose various risks to individuals, impacting their daily functioning and quality of life. Symptoms such as dizziness, fainting, fatigue, and blurred vision can result from inadequate blood flow to vital organs, leading to discomfort and potential complications. Prolonged hypotension can also increase the risk of falls, especially in older adults, and may contribute to cognitive impairment and reduced physical performance. Monitoring blood pressure levels regularly is crucial for detecting and managing hypotension effectively. By keeping track of blood pressure readings, individuals can identify any fluctuations or persistent low levels that may require medical attention. Regular blood pressure checks can help healthcare providers assess cardiovascular health, adjust medications if necessary, and provide guidance on lifestyle modifications to maintain optimal blood pressure levels. Understanding the implications of hypotension on overall health empowers individuals to take proactive steps in managing their condition and reducing associated risks. By staying informed about low blood pressure symptoms and potential consequences, individuals can seek timely medical intervention and adopt strategies to improve blood pressure regulation. Hypotension is a condition that warrants attention and awareness to safeguard one's well-being. Stay tuned for more insights on managing hypotension and optimizing overall health. Recognizing the signs and symptoms of low blood pressure is crucial for identifying potential health concerns and seeking appropriate medical attention. Hypotension can manifest differently in individuals, with varying severity and impact on daily life. By understanding the common symptoms of low blood pressure, individuals can take proactive steps to address discomfort and prevent complications. Common symptoms of low blood pressure include dizziness, lightheadedness, fainting spells, fatigue, and blurred vision. These manifestations occur due to inadequate blood flow to the brain and other vital organs, leading to temporary disruptions in normal bodily functions. Individuals may experience these symptoms intermittently or consistently, depending on the underlying causes of hypotension and individual health factors. It is essential to note that low blood pressure can present differently in various individuals. Some people experience mild, easily managed symptoms, while others may face more severe and persistent manifestations. Age, overall health status, medication use, and underlying medical conditions can influence how low blood pressure affects an individual's well-being. By being attuned to their body's signals and monitoring for any changes in symptoms, individuals can better understand how hypotension impacts their daily lives. Knowing when to seek medical attention based on low blood pressure symptoms is crucial for timely intervention and management. If symptoms such as severe dizziness, fainting, chest pain, shortness of breath, or confusion occur, it is essential to seek immediate medical help. Additionally, if low blood pressure symptoms persist or worsen over time, consulting a healthcare provider for a comprehensive evaluation and personalized treatment plan is recommended. By recognizing the signs of hypotension and knowing when to seek medical attention, individuals can take proactive steps to address any underlying issues and ensure their well-being. Stay tuned for more insights on managing low blood pressure and promoting overall health. Managing low blood pressure effectively involves medical interventions, lifestyle modifications, and proactive measures to support optimal blood pressure levels. By exploring the available treatment strategies and incorporating healthy habits into daily routines, individuals can address hypotension and improve their overall well-being. This section will explore the various options for managing low blood pressure and promoting cardiovascular health. Medical interventions play a crucial role in raising blood pressure levels for individuals with hypotension. In some cases, therapies like physical therapy or biofeedback techniques may be recommended to improve blood pressure regulation and reduce symptoms associated with hypotension. In addition to medical treatments, lifestyle modifications can significantly impact blood pressure levels and overall cardiovascular health. Dietary changes, such as increasing salt intake, consuming adequate fluids, and incorporating foods rich in nutrients like potassium and magnesium, can help regulate blood pressure. Hydration is vital in maintaining blood volume and supporting healthy circulation, while regular exercise routines can improve cardiovascular fitness and control blood pressure. Consulting healthcare professionals for personalized treatment plans is essential for effectively managing low blood pressure. By working closely with doctors, nurses, or other healthcare providers, individuals can receive tailored recommendations based on their health needs and underlying conditions. Healthcare professionals can offer guidance on medication management, lifestyle adjustments, and monitoring strategies to optimize blood pressure levels and minimize symptoms of hypotension. Stay tuned for more tips on maintaining optimal blood pressure levels and enhancing overall well-being. By recognizing these triggers, individuals can address underlying issues and prevent complications associated with hypotension. Identifying the symptoms of low blood pressure, such as dizziness, fainting, fatigue, and blurred vision, is vital for early detection and intervention. Consulting healthcare professionals for personalized treatment plans ensures individuals receive tailored guidance and support in managing hypotension. We encourage viewers to stay informed about their blood pressure levels, recognize the signs of low blood pressure, and seek medical advice when needed. Remember to like, share, and subscribe for more health-related content to stay informed and empowered in your wellness journey.